Hi everyone, Dr. Moses here. We're talking about teething today. Teething. Teething essential is the process of your baby's teeth breaking through the gums, the process of the teeth moving and erupting, breaking through the gums. This is a normal process in all babies. It often starts somewhere between the ages of 4 and 8 months. But that number varies. I've seen babies start teething before then. The time it starts is going to be different from one child to another. Now, often the two middle teeth on the bottom are the ones that protrude first, and then the two of the top go next, and the rest of the teeth follow along. Again, that's probably in most scenarios where the two middle bottom teeth show up first. But I've seen situations where the two top teeth show up first. So, what erupts first in your baby may be different. By the time a child is 2.5 years old or 30 months, all 20 baby teeth should be out by then. Now, I want to talk about some of the symptoms that we see with teething. On the top of the list is drooling. So babies drool normally, but when it comes to teething, it's like an excessive amount of drool, where you have to like put a bib around their neck and they're just constantly soaking the bib. So when the drool seems to be more than usual or excessive, it may be a sign that your baby is teething. Another thing we may see is babies putting their hands in their mouth, typically their whole fist, their fingers. Anytime they're on you, they just want to gnaw on your skin. So when babies want to just put everything in their mouth all the time and looking for things to chew on, that could be a sign they're teething as well. Now, it's a normal milestone for babies to put stuff in their mouth and put their hands in their mouth. But again, when it's excessive, that could be a sign that they're teething as well. And now when the gums are a little swollen, sore, that's a sign of teething as well. And then crankiness, fussiness. Your baby may be a little fussy. That's a sign of teething. Now, some signs that are not teething or we should not attribute to teething. Number one, fever. Teething may make your body temperature go up a little bit, but you should never have a fever. If your baby has a temperature of 100.4 or higher, that is not from teething. Make sure you have their healthcare provider evaluate them. Now, even though babies seem to have diarrhea and diaper rashes every time they're teething does not, I repeat, does not cause diarrhea. It's more of a coincidence. Around the time teething ramps up is usually the same time we're offering our babies new foods, fruits, veggies, different things like that. And the baby's gut adjusting to those new foods tends to be what leads to the looser bowel movements. Now, if your baby has frequent loose stools or a diaper rash or the diarrhea is persistent, certainly speak to your healthcare provider as soon as possible, as it may be a sign of something else, because teething will not cause diarrhea. Furthermore, teething does not cause upper respiratory infections. It doesn't cause ear infections. Those are things that I've heard. Teething will, again, make your baby fussy and uncomfortable, but it shouldn't make your baby overly angry and crying and just a situation where they seem inconsolable. If that's going on, please make sure your child sees their healthcare provider just to be evaluated to make sure there's nothing underlying happening. Rash around the face can be from teething. And that's really because you're constantly drooling. And when that drool sits on the face, sits on the skin around the mouth, that can cause you to develop a rash. But I just want to clear up, fever, diarrhea, not from teething. Now, if your baby has a diaper rash as well, that could be from them having frequent loose stools, and that'll give them a diaper rash. But the actual diaper rash itself is not from teething. Make sense? Good. Now, what are some things that we can do to help with this discomfort that our teething babies are feeling? Those teething rings, teething toys, doing cold teething toys tend to be very helpful and comforting our little ones and help with managing some of that discomfort they're feeling. So a lot of times, if you have any of those rubber teething toys, the teething rings, you can just put them in the refrigerator for some time, and when it's cold, it's typically soothing on the baby's gums. You can also make sure you wash your hands and just kind of massage the gums, just putting a little pressure with your fingers on the baby's gums. Is typically soothing as well, but always make sure you wash your hands before and after you're doing that. Now, another thing you can do is use a wet or chilled washcloth. That method worked well for my children. I would just take a clean washcloth, dip it in some cold water, squeeze it out, and then they would just kind of go to town on that all day long. I found that to be helpful. And make sure whatever it is you're giving them is something that is big enough that they can't choke on it, obviously. Now, let's talk about some things that I know a lot of people use, but scientifically has not been shown to have any benefit, and some actually may be harmful. First on that list are those teething necklaces. Now, I have parents that swear that these things work, and if they do, great. Just one note of caution, there was a child that died several years ago from strangulation from one of those necklaces. So if you are going to use that necklace, I am begging you, only use it when you can actually observe your child. Your child should not be sleeping with that necklace on, and your child should not have that necklace on unsupervised. There has been number of children that have been able to get that necklace into their mouth and, basically take off the beads and actually swallow some of them as well. So to avoid the risk of them being strangled with this necklace, or, swallowing the beads or choking on one of them, please only use it if you're able to continue to monitor your child when they have it on. If you cannot watch your child, or if you're putting your child to bed, please take the necklace off. And a lot of scientific studies have been done that have shown no significant benefit with those teething necklaces. But again, if it works for your child, it works for your child. My point of caution really is just to make sure you do not have it on your child's neck when you're not there to be able to monitor them. Now, there are a lot of the over-the-counter teething gels and teething drops. Do not give a child anything that has benzocaine in it, all right? If it says it has benzocaine, do not give it to your child. Do not give anything to your child that has belladonna in it. Again, all of these over-the-counter teething gels and drops that have any of these ingredients in them, please completely avoid them. Now, there are others out there that are quote unquote organic. Those have different things like glycerin and water and fennel and all kinds of stuff in them. Those may or may not help. If you try these things and it does not work, you don't see any difference, please stop using it. Literally, all you have to do is massage your kids' gums with clean fingers, have them, chew on a cold washcloth or just the cold teething rings. A lot of times that's all you need to get them through this teething period. And now if the teething discomfort is, you try all of those things, but the baby's still very, very fussy, and we're sure it's from teething, you could talk to your healthcare provider about, providing your child with some sort of pain reliever medicine, whether it's ibuprofen for those kids that are 6 months and older, or acetaminophen for, those that are 6 months and older, or a little bit under that. I rarely give my babies or recommend that children, get Tylenol or Motrin for teething, because doing some of those other non-medication measures tends to be all you need to help. And please do not rub alcohol on your baby's gums. Please. It's not funny. It's not safe. It's not good. Please don't do it. Yes, I know your parents did it. I know your grandparents did it. Thank God we're still alive. But please don't do that to your babies. That's all for now with teething. Thanks for listening. Until next time, stay blessed.